Allie Thelen is a certified veterinary technician with our dentistry and oral surgery service here at AERC. And it's very exciting that she is working to get her veterinary technician specialty in dentistry as well. So she's got a ton of great information for you today on the oral exam and home care. So I'm going to turn it over to her.
Hi, everybody. Really excited to be presenting. Hopefully next time we can do it in person, but we are going to go ahead and get started with everything here. So this is going to be the complete oral exam and home care and what your role is going to be as a vet tech. Just want a little shout out to my dentistry team. We have our two dentists, Dr. Erin Vicari and Dr. Elizabeth Brine. Oh, and then on the next slide, it was supposed to be, we have our technicians as well. We have Laurel Bird and Heidi Olivier. They are both VTSs in dentistry. We have me, Allie Thelen, and I am in training for getting my VTS in dentistry. And then we have Ashley Kelly. She is newer to our team. She's awesome. So we're going to get started. Just a little bit about me to start with. I went to North Dakota State University and I got my bachelor's degree in veterinary technology. That was back in 2016. And since then, I worked in general practice for 4 years, found out I loved dentistry, and then had the opportunity to join the dentistry team at AERC in 2020. Things I like to do, I like to be outside, hunting, fishing, snowboarding, camping, but I also like to binge a good Netflix or Hulu series. And then I have two cats. I have Kelly on the left and then Marnie on the right. So things we are going to cover today, we are going to talk about a bunch of different things. Some of it might be a review for you, but these are all going to be things that are going to pertain to your job as a technician, helping get the oral exam done, and then also your job as a technician introducing home care to clients and helping them be successful with it. So first, we are going to talk about some anatomy. And like I said, this is probably going to be some review for quite a bit of you guys, but it's really important to know what you're talking about and what you're charting. So the first thing we're going to talk about is the enamel of the tooth. And this is the outermost layer of the tooth itself. It's the strongest part of the tooth. So this is where we're going to see some of our fractures, things we're going to write down about that. Next is going to be your dentin. This is the second layer of the tooth, and this actually makes up the bulk of the tooth. So when you start to see some staining on the tooth, it's very porous part of the tooth. So this is going to be some of the dentin that's exposed. And then next is going to be the pulp cavity, which everybody probably knows contains the blood vessels and the nerve of the tooth. And this is what you're going to see when you have some type of fracture, whether it's a complicated crown fracture, crown root. We'll talk about this a little bit more further in the presentation. And then the last thing is going to be our gingiva. We all probably know that this is the soft tissue that's going to surround the teeth. And then we're going to really look at the gingival sulcus. And this is the area or the little valley between the gingiva itself and the tooth. This is where we're going to find our periodontal pocketing, which again, we'll explain a little bit more further down. Next, we're going to go through some directional terms. These are really important to know when you are charting your exam or when you're going to be explaining what you're seeing on your exam to someone who's charting for you. So we have a couple different terms. Some apply to the tooth surfaces and some apply to the non-tooth surfaces. So like the face. The first one's going to be mesial and distal. Mesial is going to be the surface of the tooth that is closer to the midline of the mouth or the middle of the mouth. And then distal is going to be the furthest part away from the midline. So kind of like the back of the tooth. We can show you some of that later too. And then some of the non-surfaces of the teeth are going to be rostral and caudal. So when we're using rostral, we're talking about closest to the nose of the pet. And then of course, caudal is going to be towards the back of the pet, so towards the tail. This gets used a lot when we're describing oral tumors that we're finding or anything extraoral on the face that we might be finding, anything that isn't talking about a tooth surface. And then a couple more, you guys probably know this, again with some review. We have our buccal aspect of the tooth. So this is going to be both on the maxilla and the mandible. And this is going to be the part of the tooth that is facing the cheek or the buccal mucosa. There is another term that's kind of interchangeable. It's mostly used in human dentistry, but this is going to be labial. And that's talking about the tips. So typically the incisors of a dog can be used with labial, but again, not many people use that term. So buccal is just fine. And then only pertaining to the maxilla, we're going to have palatal. So that's the surface of the tooth that is facing the palate or the roof of the mouth. And then the last surface we're going to talk about is going to be only on the mandible, and this is the lingual surface. So this is going to be the part of the tooth that is facing or touching the tongue. All right, so a couple more we're going to talk about. These are also tooth surfaces. We are going to talk about coronal, apical, and occlusal. Coronal is going to be the direction towards the crown of the tooth. So in my picture here, you can actually see a red arrow. This is going to be pointing down, so towards the crown. Next is going to be apical, and this is going to be facing the apex or the root of the tooth. And then the last one is occlusal, and this is going to be your chewing surfaces of the teeth. So you're mostly just going to see this with your premolars and your molars. And this is oftentimes where a lot of staining could be found from wear and tear on the teeth. Okay, another review, numbering teeth. So a lot of people use the Triadan system. We're only going to talk about that one because that's what we use here in our dentistry service. It's very important to know your teeth numbers, not only when you are charting, trying to be efficient and fast, but also when you're relaying your medical records towards other clinics, or even just to keep a good record in your clinic. So this one I think is some of the easiest ways to do it. You're going to start with your right maxilla. This is going to be the 100s quadrant. So there's 4 quadrants: 100, 200, 300, and 400. And this is going to be determined by which location on the mouth you're talking about. So your right maxilla is going to be your 100s, and then you're going to go clockwise around the skull, just like the picture I have here. So it's 100 right maxilla, 200 left maxilla, 300 is going to be the left mandible, and then 400 is going to be the right mandible. And this is just for the adult teeth. It's also important to know your puppy and kitten teeth as well, so your deciduous teeth. And this is just going to be a continuation of your adult teeth. So your upper right or your maxillary right would be 500, and you're going to continue on. So 600 for the upper left, 700 for the lower left, 800 for the lower right. Another thing that was really good to help you kind of remember, what tooth you're talking about in the mouth is the rules of 4s and 9s. And this actually applies to both dogs and cats, so it's kind of easy to remember. Always remember that a 4 is going to be a canine and a 9 is going to be a molar, whether it's a cat or a dog. So now we'll just briefly talk about the actual numbers of the tooth. You can see on my chart here, it just goes through every single tooth, but just a couple of things to remember: that the maxilla on a canine or dog is going to go from 1 to 10, and then the mandible is going to be 1 to 11. I did include our dental formula. I think it's really important to know this because it's going to help you remember how many types of teeth are in the mouth, but also help you figure out which number is each tooth. So with our dental formula, you always times it by 2, but just remember there is 3 incisors on the maxilla, 3 on the mandible. There's going to be 1 canine on the maxilla, 1 on the mandible. There's going to be 4 premolars on both the maxilla and mandible, and then 2 molars on the maxilla, 3 on the mandible. So if you times that by 2, you get 42 teeth. And now we'll talk about the cats. So again, both maxilla and mandible go from 1 to 9 in cats. So it's kind of nice. You don't have to worry about it being more or less like with the dog. I include the dental formula here as well. Again, 3 and 3 incisors. We have 1 and 1 canine, 3 and 2 premolars, and then 1 and 1 molar. So 30 teeth total. Again, I'm going to bring up the 4s and 9s rule because it's really important when counting the teeth in the cat, because they're missing some teeth like the dog. So just remember, 4 is going to be your canine and 9 is going to be your first molar. So when you're counting teeth for cats, because they are missing their 5s on the top and their 5s and 6s on the bottom, you're going to bring up that rules of 4 and 9. So start with an incisor right at the midline in whatever quadrant you're working on, and count your incisors to your canine, so 1 through 4. And after that, since you know that cats always have a 9 as their last tooth, you can count from 9 and then go back. So 9, 8, 7, and 6 if it's the maxilla. Just a little trick, super cheesy trick that you can use to remember this is that cats have 9 lives. So therefore they always end in 9. So just remember, 9 is the last tooth with your cats. All right, so next we're going to talk about the different types of teeth. So we have our incisors, canines, premolars, and our molars. And I pulled up these sheets. I think Heidi is going to be able to give you guys either links to the handouts. Oh, fabulous.
Right now.
Perfect. You guys have my handouts. This is kind of nice. It has these pictures in them, but it's just really nice to be able to see where the teeth lie in the mouth. So you have our incisors, canine, premolars, molar. Again, whether it's the maxilla or mandible, it's just nice to see where they lie in the maxilla and in the jaw. And then here's just a picture of our cats as well. So same thing, you can see that it's always incisors first, canine, premolars, and then molar. So we're going to talk about the roots of the teeth next, because it's really important to know how many roots each tooth has. So one thing you can remember always and feel confident about is that incisors and canines are always going to have one root, whether it's a cat or a dog. So I included some x-rays of incisors. Next, we're going to talk about the tooth roots in a dog, and we're going to start with the maxilla. So it's kind of nice with the maxilla. You can just remember that the first tooth is going to have one root. The next two teeth are going to have two roots. And then the next three teeth have three roots. So the two rooted teeth and the three rooted teeth are important to know which one has which, because later in our presentation, we'll talk about checking for furcations and what that means. But again, this is just a really good picture to show you an example of where those roots lie. And just remember, 1, 1, 2 has 2, and then 3 of them have 3. You can also remember, again, we like cheesy tips and tricks. 3 starts with a T and top starts with a T. So just remember that there are only going to be 3 rooted teeth, on the top or the maxilla. All right, next we have the tooth roots for a dog, but this is going to be the mandible. So think of the mandible as a bookshelf with bookends. Your first and your last teeth are going to have one root because they are a bookend. They hold things in place. They hold books in place. Your following teeth in between those bookends are going to be books that have 2 covers. So all of the teeth between those 2 ends are going to have 2 roots, like the covers of books. So this is a really good picture. You'll see the first premolar in this example, we have 305 has 1 root, and then the 306, 7, 8, 9, and 10 have 2 roots like books, and then the end, the 311 has 1 root. So just think bookends and books. And then it's a little bit different with our cats. So on the maxilla, we have the kind of similar to the dog. The first tooth has 1, second tooth has 2 roots, third tooth has 3 roots. The fourth tooth, so the molar, it's all up for interpretation. Usually it can have 1 root, 2 roots, or 3. I would say oftentimes more than others, it's going to be 3 roots fused into 1. So that's why when you take your x-rays, it kind of just looks like a little ball. And this is another good picture just to show you where those lie. And then next for the mandible, cats don't have bookends. So cats don't have any single rooted teeth besides the incisors and canines on the mandible, because if cats had bookends, they would just knock them over, because that's what cats do. So just remember that they just have books, no bookends. So only 2 rooted teeth on the mandible. Okay, so we're going to move on to our instruments, and keep in mind, this is just going to be for the oral exam itself and not for a full dental cleaning. So there's not a lot of instruments needed, but very important instruments. First, we're going to start with our probe. So our periodontal probe. This is going to be used to measure periodontal pocketing on the teeth. It can also be used for measuring gingival recession, measuring anything in the mouth really, but mostly used for probing. The probe that I have listed here is a probe that counts in 5s, goes up to 15 millimeters. And this probe is going to have, each thin line is going to be 1 millimeter. And once you reach a thick band and cover it, it's going to be 5 millimeters. Personally, I think this one's the easiest one to use, especially when you're learning, but just know that there's different probes out there and try to figure out which one you have in your clinic, just so you're using it appropriately. The next thing we're going to talk about is our explorer and our shepherd's hook. And this is going to be the sharp pointy end of your probe. Usually the opposite end is your explorer, but this is going to be used to help us find any defects on the enamel of the crown or along the gum line. You have to be really careful when you're working around the gum line, just because it is sharp and that is a sensitive area. But things that we're looking for is going to be fractures in a tooth. It can help us decide if it's complicated or uncomplicated, so exposed pulp or not exposed pulp. But it can also help us find small chips in the enamel. It can help us find tooth resorption in cats and dogs. So it's a really helpful tool. Just remember that it is sharp. And then the other thing we like to use, not a lot of clinics probably use them, but we have eye loupes here, and they can be as fancy or as simple as you want. The technician loupes that we use here are going to be the middle ones that you can see on the slide. They're very nice because they provide both magnification and light. So magnification is great when you have that tiny little chihuahua mouth or a little cat mouth and you're looking for really small things. But the light's really nice because it follows your loop. So wherever your head turns, your light follows, and you don't have to worry about getting hit in the head with your overhead light, because I definitely do that a lot. So they're very nice. You can get them from a professional rep. There's some down here in the cities, or you can even find them on Amazon for a fairly good price too. They're adjustable. There are some like ours that are set. So really good to look into, even if you can invest in one set for all of your technicians. Okay, so now we're going to move on to the big important part of this presentation, the oral exam. It is going to be the evaluation of your extraoral structures, your intraoral soft tissues, and then the teeth themselves. So there's a lot that goes into the oral exam. This is going to help the doctor decide what treatments you want for each tooth, along with the dental radiographs that you're going to take too. So this is why it's really important to make sure you're not missing anything on the oral exam, so that things aren't getting missed after the x-rays are taken. The first thing I'm going to say is you should learn your AVDC abbreviations. So American Veterinary Dental College abbreviations. Some people are probably like, I don't know what this is. I've never heard about it. I'll be honest, before I started working here, I didn't really know much about it. I just knew that there were some abbreviations that we used for different things we found in the mouth, but nothing like this. This is really great to look at and look into because it's a lot easier and a lot more uniform when you're charting your oral exam findings. Here at AERC, we are able to have one technician do the oral exam and one technician write down the oral exam findings. So we become very efficient if I'm writing out, there's a complicated crown fracture on 104. There's a small code that we put in an arrow to that tooth, and that's written down. So it's really good when you have a lot of stuff to chart down. And then again, it's uniform. So I could send this chart off to another clinic, and they're going to understand everything we found in that mouth because it is the universal codes that are used. There's both diagnostic and treatment abbreviations. So it's really important to know which one's which. I did put the link on just because it's kind of hard to find on the AVDC website. If you do go to their website, you can just type in their search bar the nomenclature and you should be able to find it. But if not, this long website right here is going to be helpful. And then this is just an example of what it looks like with the printout that you can get. Keep in mind, it is like 10 pages long, but we're going to talk about finding the best ones that your clinic is going to use, or the most common ones, I should say. So you don't have to have all of this memorized. It's just good to know the ones that you see often. And then, like I said, you can pick out the most common abbreviations and kind of make a little cheat sheet. This way, you have them right there if you forget what the code is or what the abbreviation is, and you can just look down on your dental chart. I'll show you an example of our dental charts later in the presentation too, but this is just a couple examples. We see tooth fractures all the time. So you would write down T for tooth, FX for fracture, and then whatever fracture you found. So this one's a complicated crown fracture, so it would be CCF. Another really common thing I feel like we write down is going to be gingival enlargements. So GE stands for gingival enlargement, and then you can write the number behind it of how big that enlargement is in millimeters. Again, you can get a printout of this on their website. On to the oral exam. Okay, so the first part of the oral exam is actually not going to be inside the mouth. It's going to be the extraoral exam, which is equally as important as the intraoral exam. These are the things you're going to look for. You're going to look for facial symmetry. So you're going to feel their cheekbones. You're going to feel their jaw bones, muscles up on the top of their head. You want to make sure that things are symmetrical and not swollen. Also, you're going to look for masses. I think you guys might be able to see my pointer, but this one up here, this dog actually came in, it's the upper right picture. This dog came in for a root canal, And we actually found this small mass here, and it ended up being melanoma. So really important. The dog came back in for a lip resection. If we wouldn't have found that, this dog would be living with melanoma, and who knows how long he would have been okay. So really important to note those and find those. Next, you're going to look for eye discharge and nose discharge and note the color, which eye, which nostril, how much there is. Very important, especially when we have pets that have a lot of infection going on. You're also, like I said, going to look for swelling. It kind of goes along with the facial symmetry. But then you're going to palpate the lymph nodes and make sure that they are small, symmetrical, smooth. If they're enlarged, oftentimes, we could be looking at inflammation, infection, things like that. So the lower left picture is me palpating some lymph nodes, and then the lower right, abscess tooth. So again, very important to be doing your extraoral exam. Next, we're going to talk about the intraoral soft tissues of the mouth. So first is going to be the buccal mucosa. Things we're looking for, we're going to be looking for ulcerations, swellings, and draining tracts. That's just a few of the things, but kind of some of the really big things we're looking for. I know a lot of pets can bite on their cheeks, especially like our big pit bulls, our brachycephalic dogs, lots of animals like that. So noting if they have those little chewing lesions in their cheeks, whether they're just really mild or even if they're, pretty severe and they have ulcerations. I have a couple of good pictures. The two middle pictures are some good examples of ulcerations. The lower left picture is a good example of inflammation. So this was a stomatitis cat. He had a lot of swelling and inflammation in his mouth. And then the picture on the right is, I think if you're zoomed in pretty good, you can probably see it, but it actually has a little draining tract under this discolored 302. So just really small things to look for, but very important things. Next, we're going to talk about the tongue. So we're going to note, again, ulcerations, masses, swellings, lacerations, if they're coming in for an emergency. Make sure you're looking underneath the tongue, as well as the top of the tongue and the sides of the tongue. Next, we're going to talk about the palate. So a couple different things you're going to look for, some more common than others. I would say a less common one, if you're doing like your dental and things like that during the oral exam when they're anesthetized, would be clefts in the palate. This could be a good one when you have, your puppies and kittens come in for their first exams when you're doing an awake oral exam. But just to keep in mind, look for those clefts. Soft tissue trauma is important. Oftentimes it could be from a malocclusion, which we'll talk about later. You can see the lower right picture. There's a little soft tissue indent or hole between that third incisor and canine. This was a dog who had malocclusion, and that's actually from a tooth sticking up into the roof of its mouth. And then the last thing you're going to look for, masses, ulcerations. This cat here on the lower left has a palatal mass. So lots of things to look for. Next, you are going to look at the tonsils and pharynx. So depending on how your clinic runs, here we're lucky enough to have awesome anesthesia technicians help us so we can focus on our dentistry. So we'll often have them look upon intubation to just make sure that the tonsils and the pharynx look normal. You're looking for masses, swelling, inflammation, ulceration, things like that. So these are some pictures of normals, but this is a good thing to be looking for. Next, we're going to talk about occlusions. These are very important. It's always important to note these as soon as your pets come into the clinic. So again, I know we're talking about anesthetized procedures, but the awake oral exam is just as important too. So this is going to be a picture of your normal occlusion. So as you can see, the lower middle picture, we have our maxillary incisors fitting in front of the mandibular incisors. So just like this, if this is my maxilla, this is my mandible. Next, you want to make sure that the mandibular canine fits between the space of the upper third incisor and then the canine. You want to make sure that the premolars interdigitate. So on this picture here, you can see there's just enough space for each tooth to fit without actually touching each other. And then the last thing you want to look for is the upper fourth premolar. So the maxillary fourth premolar is going to sit just outside of the first mandibular molar. So that really big molar on the mandible. So now that we've talked about normal, we'll go into the different abnormal occlusions or malocclusions. So malocclusion 1 is going to be pertaining to one or more teeth in an abnormal position, but the jaw is the correct length in comparison to the maxilla. So this can be kind of a tricky one to find, but what you're going to use is your directional terms we talked about earlier that apply to the tooth surface. So this right picture here, we have a labioverted canine because it's tilting towards the lips of the, I know we said lips could be incisors, but it's tilting out towards the lips. And then our lower picture here is the same thing, except for it's facing out forward towards the lips. Layman's term would be a lanced canine, but again, we like to try to use our medical terms since it's more universal. But again, mesio, labial, palatal, and lingual are going to be very important when you're describing these occlusions. Next, we'll talk about our malocclusion 2 or an overbite. I would say this is probably a more common malocclusion that you're going to find along with the next one. You can see here that the jaw is just too short for the maxilla. So when that happens, we worry about those soft tissue traumas on the palate we talked about earlier from the mandibular canines not going into their correct placement and hitting the roof of the mouth. So these are very important to note, especially in our puppies when they come in for those first appointments. So the opposite of an overbite is an underbite, and that's going to be the malocclusion 3. So as you can see here, most of these dogs are probably brachycephalic pets. Oftentimes we find it in our Shih Tzus, our pugs, different breeds like that. But the worry with this malocclusion is that your maxillary incisors aren't out in front of the mandibular incisors. They're actually behind them. So they're going to cause some trauma to the soft tissue and the teeth behind them. So again, really important to note when you first see them and how severe they are. Next, this one's probably not as often seen, but very important to know, is going to be a malocclusion 4. And this is typically due to trauma, whether it's past or present. When I say present, it would be, the hit by car cat that comes into your clinic. And when I say past, it could be a kitten that got bit by a dog when it was younger, and now it's grown, and maybe one jaw hasn't grown as fast as the other. A layman term for this would be ribite. It can be used to describe a bunch of different types of malocclusion 4s, but again, try to keep your medical terms when you're logging this in the actual medical record or on your chart, just to be consistent. And just note that a malocclusion 4 is going to be some kind of asymmetrical occlusion. So now we're going to actually talk about the teeth. This is stuff that all of you guys probably know, but it's very important to go over again. So we'll start with periodontal pocketing. As you can see on the top, I did put the AVDC abbreviation up there too. So all of these will have their abbreviations up top. When you are probing the teeth, you are going to be probing 6 parts of the tooth. So when we're talking about that, we're talking about the buccal surface, and then the palatal if it's the maxilla, or the lingual if it's the mandible. So we're going to probe the mesial aspect, which is closest to midline, the middle of the tooth, so either buccal or palatal, or buccal or lingual, and then the distal part of the tooth. So if you add that all up, we get 6 surfaces. Just remember your normals. A normal for a cat is from 0 to 1. Normal for a dog is 0 to 3. But also use your best judgment when you're marking down or, mentioning these to the person who's charting for you. You could have a, pocket of 4 on a canine on a Great Dane. That might not be as significant, but if you had a pocket of 4 on a canine of a Chihuahua, that could be much worse. So again, just use your best judgment. When in doubt, just write it down. Next, we're going to talk about the calculus index. So I'm sure you guys can probably smell this mouth from your computer. It's pretty gross. You've probably seen it in clinic too. But there are 4 categories for calculus. You have 0, which is going to be normal, no calculus, not even a speck. You could have CI1, which is going to be mild. So I would say this top one up here, if we were looking at the upper 4th premolars, maybe there would be a little bit of calculus. That could be mild. CI2 is going to be moderate. So a lot of the teeth are going to have some calculus on them. And then severe is going to be CI3. So this lower one would for sure be severe. Just keep in mind when you are doing these calculus indexes, you want to make sure that you're looking at the worst tooth in the mouth. So even if a dog only has 3 teeth that are covered in calculus, I would still give that dog a severe calculus index. All right, gingival index. So again, there's 4 categories. 0 is going to be normal. And then we'll move on to the next 3. And these pictures actually are going to correspond with each one. So first picture on the left is going to be a GI1. There will be no bleeding when you're probing, but there's going to be some mild inflammation. So you can kind of see that thin pink line of irritation right over the teeth. That would be a GI1. GI2 is going to be our next one, and this is going to be bleeding on probing. So you're starting to get a little bit of blood on each tooth when you're probing, and there's going to be some moderate inflammation. So you can see each tooth has quite a bit of inflammation around it, but not so much that we would say severe. And then severe, or GI3, is going to be spontaneous bleeding. So we always say you look at it and it starts bleeding, that's a GI3. It's also going to have severe inflammation, not only along the gingiva, but it could be really anywhere in the mouth too. Next, we're going to talk about gingival enlargement. It's very important to measure these enlargements. I know when you have, a full mouth generalized gingival enlargements, you're going to be like, why am I measuring all of these? Because when you are measuring those, you're also going to get the pocket depths, because a lot of times when you have gingival enlargement throughout the mouth, it's going to make fake pocketing. So it's really important to know that if you measure an enlargement that's 4 millimeters, and then you get a 4 millimeter pocket underneath it, there's no attachment loss because it's just the gingiva making a fake pocket. When you're writing down your enlargements, you also want to use really descriptive words. So this picture in the upper right it's round, it's pink, it's raised, it's smooth. All of this is going to be helpful whether or not you do send it in for a biopsy, because when you do send it in for a biopsy, these characteristics can help the pathologist figure out what this could be, along with what they find on histopathology. But if you aren't going to be sending it in, it's really important to note, year to year, has it changed? Has it grown? Is it getting more ulcerated? Just things like that. So really important to use all your descriptive words. Next, we're going to talk about tooth furcation or furcation exposure, so FE. Remember, furcation is going to be the space between 2 tooth roots, or 3 tooth roots, I guess we could say. But there's going to be 4 categories. So 0 is normal. There's, you're no bump. You're not going into the groove at all. FE1, or furcation exposure 1, your probe is going to sink, but it's going to be less than halfway. So it might just catch when you're doing your probing. If your probe sinks and goes a little bit more than halfway, but doesn't go all the way through, that's going to be furcation exposure 2. And then furcation exposure 3 is going to be through and through. So on this picture, you can see that second premolar right here goes through and through. The only reason why it looks so nice and you can actually see those roots is because this patient came in for a procedure and we staged it. So the dog already had extractions on the other side of its mouth. And this way we just clean everything up so that when he comes back in 2 weeks, or 2 to 3 weeks, or maybe a month, it's going to be nice and clean and healthy for extractions. All right, next one, gingival recession. So this is going to be important to measure again, and you can use your probe when you're doing this. The reason why you want to measure how much gingival recession there is that we are going to add it with our periodontal pocketing measurements to get our total attachment loss. So when you do this, so for measuring this tooth, say we get 4 millimeters, and then we probe it and we get another 3 millimeters, that total attachment loss is going to be 7 millimeters. So really important for our doctors to know when they're going to treat the tooth or figure out what the best treatment will be for that tooth. All right, on to missing teeth and extra teeth. So of course you always want to mark down which teeth are missing, but you do want to note when there's extra teeth as well and what type of teeth they are. As you can see, we have supernumerary teeth and we also have retained deciduous teeth. So with supernumerary teeth, I got a really good picture here of a cat who has a supernumerary premolar. So you can tell because the crowns match. Again, you're going to take dental x-rays to completely confirm, but this is an extra adult tooth, where if you have a retained deciduous tooth like this one, or like these ones over here, those are going to be the baby teeth that have not fallen out. So we have adult tooth and then baby tooth. Very important to note both of them and then have your doctor decide what treatment is going to be best for those teeth. All right, I'm sure you can see these flapping in the breeze. We're going to talk about mobility. So M. So when you're doing your mobility, and this could be when we're doing our extraoral exam as well, when you're feeling the mandible of a cat or a dog, sometimes you can get a little symphyseal laxity, so a little bit of movement with the symphysis, and that can be normal. It kind of goes along with our M1, so a mobility of less than 0.5 millimeter. I would say if your symphysis feels like that, normal, but if it's really moving around, it's definitely something you want to note with your doctor. But with our mobility, this is going to be movement in any direction. So M1, mobility 1 is going to be less than 0.5 millimeter in any direction. M2 is going to be 0.5 millimeter to 1 millimeter in any direction. And then M3 is going to be exceeding 1 millimeter. So I'm sure, you know, this is a M3 probably all the way around those incisors. And then I have a good picture down here of how you can help detect mobility without using your fingers, because it can be a little subjective when you're using your fingers. If you use the heel of your probe, just like right here, and use that nice and firm to help move around the teeth, it can be really useful when deciding how mobile a tooth is. Next, we'll talk about enamel defects and enamel hypoplasia. These are our codes for that. Enamel hypoplasia, just remember, is going to be an inadequate deposition of the enamel matrix. So when you're looking at these pictures, you can see it can affect one or more teeth, and it can be focal or multifocal. So focal being one spot on one tooth, or multifocal could be multiple spots on one tooth. So the first two pictures are actually from the same patient. You can see we have some enamel hypoplasia here on the lower molar, but also the upper fourth premolar. And then there's much more once they moved closer to the front of the mouth or more rostral, where this picture on the right is an example of an enamel defect. So just one small defect on the tooth. And it's kind of right mid-body, and oftentimes they collect a lot of calculus. So good to know. Next, we're going to talk about fractures. And this is probably the biggest thing you guys see and have to, note for your doctor so they can decide, best treatment for these teeth. We have complicated fractures where the pulp is exposed, and then we have uncomplicated fractures where the pulp isn't exposed, and it's just fractured down to the dentin of the tooth. With that, you have crown versus crown root fractures. So my picture on the lower right is a good example of a complicated crown fracture. You can see nothing was broken off to the root of the tooth, but the crown definitely was fractured, and you can actually see if I were to take my shepherd's hook or my explorer, it would probably sink right into that pulp. Where on the left side, we have a complicated crown root fracture. This is also known as a slab fracture in layman's terms. But again, this is a complicated crown root. You can see that part of the crown is lifting up, and it actually goes under the gum line. So this would be confirmed with a dental x-ray just to make sure that that piece is still attached and that nothing else has broken. But again, if you stuck your explorer right here, you'd probably get into that pulp canal. And then just remember, there's only 2 treatments for fractured teeth, whether they're complicated or uncomplicated. And that can be extraction or root canal therapy, or sometimes you can do sealants on the uncomplicated crown fractures. Okay, I feel like this is the biggest debate and no one ever seems to know which one is which. So we're going to talk about attrition and abrasion. And I have a couple of tricks that are so easy just to remember which one is which. So attrition is going to be happening from tooth contacting tooth. So I like to think tooth on tooth, AT, attrition. For some reason, that just helps me remember it's tooth on tooth. And oftentimes when you have attrition, you want to look for a malocclusion, because as you saw earlier when we talked about occlusions, a normal occlusion shouldn't have contact with those teeth. They should fit perfectly in between teeth and interdigitate it. So make sure you're looking for a malocclusion if you ever see attrition. Oh man, doesn't want to go. Okay, there we go. So now we're going to talk about abrasion. So abrasion is going to be tooth on non-tooth objects. So for me, I think tooth on ball, AB, is abrasion. I know it's silly, but it works really well in my mind. So hopefully it can help you guys remember too. And with abrasion, you can often see that the teeth are going to be really smooth and really uniform in that abrasion. So like right here, our crowns are really smooth on all these premolars and molars and these incisors here, versus if it was a little more jagged, I would almost be concerned that it was a fracture versus abrasion. But again, AB abrasion for tooth on ball.
Okay, everyone, we should be ready to go. Sorry about having to re-record this. For those of you who just joined, again, I'm Allie Thelen. I'm with AERC Dentistry Service. I'm gonna start right here on the teeth and discolored teeth. I think this is about where we left off. So we're just gonna talk about this real quick. So discolored teeth or non-vital teeth are gonna happen from trauma to the tooth. Trauma leads to pulpitis, which is inflammation of the pulp. And there's both reversible and irreversible, meaning the tooth could go back to its normal state or it could become dead or non-vital after that. And that would be the irreversible. You can see that these two pictures here on the top and bottom left side, those are both purple teeth. So those would be trauma, or what they would appear to look like after the trauma to the tooth. And then if it happens to be irreversible and the tooth becomes non-vital, it can turn this tan or gray color. Next, we'll talk about tooth resorption. This can affect both dogs and cats. These are going to be painful holes or erosion on the tooth enamel. You're going to be finding these lesions on the crown with the sharp end of the Explorer. Again, it's sharp, so make sure you're not poking the gingiva or anything like that. But because it's so delicate, it's easy to find these lesions. As you can see, most of the lesions are typically close to the gum line. So just make sure that, you're probing right along that gum line to see if you can feel any catch or any roughness with your Explorer. And then you need dental radiographs to actually diagnose tooth resorption on the roots. So I know earlier I talked about our dental charts a little bit, and this is actually the template we use. You can see that on the left side, we have our teeth, and you can actually see, how many roots there are, where the teeth are, all of that. Typically, we use this spot to note any of our abbreviations. So if we have a deciduous tooth present, gingival enlargement, if we have a fractured tooth, anything like that, we can actually just write a line to the tooth and then write whatever our abbreviation is. Over here for the comments area, you can see it's blank. You can write whatever you need to on there. Sometimes it's easier to write something out like measurements, things like that. Over here on the bottom right, we have our extraoral exam, lymph nodes, buccal mucosa, tongue, palate, tonsils, pharynx, all the things we talked about earlier with our extraoral exam, and then our soft tissue exam. And then you can see this is where we actually chart our periodontal pocketing, our recession, furcation, mobility, all of that for each tooth. And then we actually have a treatment sheet as well that we use. This is where we're going to log, again, the same thing on the left. We're going to do our abbreviations with our treatments. We're also going to log over here what amount of blocks we're going to use. So we use bupivacaine and buprenorphine. So we will record what the blocks were that we did and then how much we used. And then under that is another spot where you're going to write your treatments. So that's where you're going to use your abbreviations and mark down what you did to which teeth. Next, we're going to talk about home care. Plaque is going to begin to form on the tooth surface in about 24 hours. Mineralization of plaque is going to turn into calculus in 2 to 3 days. So this is why home care is so important. There are a lot of different types of home care. Of course, you've all heard this probably a ton of times. Toothbrushing is the best. Next up, we have oral wipes. And oral wipes can be really good, and we'll talk about this more in detail for people who have a hard time actually brushing. There's water additives, dental diets, treats, dental chews, chew toys, all of those things. And it's always recommended to actually look at the VOHC website, so Veterinary Oral Health Council website. They have products in all the categories for dogs and cats. A lot of them have links as well, but all of these products have been tested and proven to some extent that they work. So this is a great place for you to actually find these resources. And when I say anyone can do it, I mean anyone can do it. This is actually my grandma. She's going to be 86 years old, and my parents' dog, Finn. They live together, and she is in charge of brushing Finn's teeth. After Finn had his first dental, she just decided that, he needs his teeth to be cleaned every day, and she was going to be the one to do it. So I like to tell people all the time that if my 86-year-old grandma can and is willing to do it, anyone can at least try it. Okay, so toothbrushing supplies. You're going to need a toothbrush. Soft bristled brushes work the best, but you can also use a finger brush or a gauze or a soft cloth. You also need to get toothpaste and make sure it is made for animals. There can be no fluoride in it. And then I have a picture up here. You can actually use gels as well. This is one that we recommend to a lot of patients or even a lot of our cats. It isn't flavored. It's good for pets with allergies, but it can be used as a toothpaste. Very important. Brushing needs to be daily. It has been proven that you can brush every other day and it's still as efficient, but we know it's harder to remember to do something every other day versus doing it, every single day. So again, we just tell owners to find a time that works best with their schedule and then just start to stick with it. So I know a lot of my clients start out wanting to do it in the mornings, but they find really quickly that mornings are busy and it's hard to get that done. So I always recommend like right before you're going to bed, you have a routine so your pet can have a routine too. So we have this handout that we give. It's actually on our website too, but it gets in all of our toothbrush kits. And this is from Hill Science. It goes through our steps, and we have 4 major steps. So the first step is going to be getting comfortable. So you want the pet to be comfortable with you touching their face, touching their lips, things like that. You really want to keep it positive. So practice touching their face and lips, and then give them a treat. Make sure that they understand that. Oops, sorry, my cat is here messing up my computer. I'm working from home today, so sorry about that. But again, just make sure that you're keeping it positive, giving treats. I tell owners they can try lifting their lips, but I think it's easier if you practice sliding your finger underneath your lips. And we'll kind of talk about this in the next step, I believe. And this is going to be trying toothpaste. So I always tell owners to offer it as a treat on your finger, just to show them that, it tastes good and it's kind of like a little snack. And once they eat it off your finger a couple times, you can either use your finger or like a piece of gauze over your finger with toothpaste. And you can just slide it under their lip and just start feeling their teeth and getting them used to having the feeling of the toothpaste and all of that going under their lips. After that, you're going to introduce the toothbrush. So same thing, you're just going to put a little bit of toothpaste on the toothbrush. Do make sure that it's the proper size brush. So a lot of times, I know CET, which is my favorite toothpaste brand, they actually have a small toothbrush that they sell along with like regular size toothbrushes. But if you don't have access to those, you can go to the kids section like at Target or Walmart and go get a pediatric soft bristled toothbrush. And that works too. Once you get the toothpaste on and the pet is licking it off of the toothbrush, you can gently slide it underneath the lip and just start brushing. Maybe you start with incisors first, you work on a canine, maybe you start working your way back into the cheek. It's okay if they just do one area per session, as long as they're getting, started with it and having success on even a couple areas, that's wonderful. And then after that, they should be able to brush their teeth. So it takes, some practice, but have them practice brushing the teeth, right up to the gum line. Have them focus on the outside of the teeth, so the buccal aspects of the teeth. If the pet is patient enough and they're doing really well, they can try to work on the insides, but it's just a lot harder, and it's just easier to work on the outsides. And then, of course, when you're finished, offer lots of praise, plenty of love, lots of snacks, and just make it a really good, happy experience. Next, we'll talk about cleansing wipes. So, like I said earlier, these can be a really good alternative if toothbrushing isn't possible. Sometimes it's easier for owners to just take a wipe each day and use it. And then again, it's still recommended for daily use. The reason why we prefer brushing over the wipes is that when you're brushing with a soft bristled brush, you can actually get, 1 to 2 millimeters under the gum line versus a wipe that can't just do that. Next, we have veterinary diets. A lot of you probably sell these in your clinic. Again, they're most effective if they're given as a main diet. You can use them as treats as well, but again, most effective if giving as the sole diet. And then you need to remember that they need to have teeth that meet to be effective. So if they're not touching other teeth, the point of these dental diets is that they're going to crunch on the kibble and it's actually going to encapsulate the tooth and, help to take off the tartar plaque. So if they don't have teeth that are going to help crunch, then they're not really going to work well. Same thing with treats and chews. They're really great. Just make sure that your dog is actually chewing on a rawhide and they don't just swallow it. Treats can be helpful and just watch the calories. Some of them, like the tartar shield, my cats love those. They're actually super low calorie versus the greenies they do like, but they're just a little bit more, higher in calories. And then again, it's only effective for pets who have teeth and who actually chew on them versus just swallowing them. Next is water additives. You can use this to help freshen the breath. It's not as effective as toothbrushing, and it's usually going to be used together with brushing. So it's most effective if you are going to brush their teeth and then add this to their water. We always say it might help, but it won't hurt. So again, not as effective as the other options. And then chew toys, what not to give. So no rocks, hooves, antlers, real bones, and nylon bones because they are too hard and they will break teeth. Bits and pieces can also break off and get stuck inside your dog's GI tract. So definitely potential for foreign bodies. And then toys that you can give, stuffable toys like Kong, pictured here with my parents' dog Harper, are wonderful. They use these for her training a lot too, but you just have to make sure that it matches your dog's size. So this one is the little blue baby one because she's a puppy, but as she gets bigger, she's going to need a stronger one and a bigger one so she doesn't choke on it. Like I said before, rawhides are fine. Just make sure you're not giving too many and make sure that they're actually chewing it. Rope toys actually are really good toys too for their teeth because of the cloth. Just make sure they don't shred it and again, eat it. Soft toys, same thing. The cloth can be really helpful, a soft abrasion on their teeth, but just make sure they aren't chewing them apart and always supervise your pets when you're using any of these, rawhides, toys, anything like that. Make sure you're watching them. And then earlier we were able to do questions with the live session, but right now, since this is recorded, we won't be able to. So if you have any questions, I did type out my personal email for AERC. It is ALTHELEN@AERCMN.com. So hopefully everybody can get that if you have any additional questions. But again, thank you so much for listening to my talk.